Hi, I'm Moses. This summer, I did research in the Department of Critical Care Medicine, and my project looks at understanding sedation in the ICU, particularly understanding the perspectives of healthcare professionals, patients, and families. Sedation is a commonly used intervention to promote comfort, reduce anxiety, and facilitate treatment in the ICU. However, excessive or inappropriate sedation is linked to delirium, prolonged ventilation, and worse outcomes. There exists a gap in the literature. No study has compared sedation perceptions and experiences across healthcare professionals, patients, and families. Qualitative research has shown that there are key barriers that have to be overcome, such as oversedation, stress, and communication barriers. Capturing these diverse perspectives is essential to designing effective patient-centered care pathways. We asked, what do healthcare professionals, patients, and families know, experience, and perceive about ICU sedation, and how do these perspectives compare? The first objective was to develop a survey/interview tool to capture knowledge and experiences. The second was to explore the perceptions, experiences, and impacts of sedation from the differing perspectives. The last step was to compare and contrast these patterns. The first step of this process was to develop an interview design. Two sets of questions were developed, one for ICU staff and one for patients and families, both focused on capturing lived experience and knowledge. The second step was recruiting participants for the study. So we recruited family members and patients throughout ICUs around Calgary. We recruited healthcare providers through professional networks and social media. Data collection was then done where we conducted Zoom/phone interviews, which were audio recorded. After these interviews were conducted, we transcribed the audio into verbatim text for analysis. Now, the next step is called coding and thematic analysis. This is basically finding patterns in what people unintentionally told us as they answered interview questions. We systematically read each transcript, identified meaningful segments in actual words. Then we looked across all interviews searching for patterns. What kept coming up unintentionally? What were multiple people describing unintentionally? When we grouped these related ideas, clear themes emerged, and these aren't theoretical, and this led to our theme development. They're patterns in real people's description of their real experiences. So we use thematic analysis, and here's some demographic data from our participants. So what did families tell us? Four major patterns emerged from their words. First, families talked about sedation providing comfort. They talked about their own relief, not just the patient's. Families told us that seeing their loved one sedated helped them cope. When asked about the perceptions, families consistently told us that sedation was beneficial and necessary. Many incorrectly thought that there weren't any risks associated. Those same families also described profound fears. They were worried their loved one wouldn't wake up, for example. But the fourth pattern is especially important. Families wanted to be more included. They wanted education, clear communication, someone to walk them through what was happening. This is not currently being done in the ICU, so this is really, really important. Patients revealed four themes. The strongest was frustration with inconsistent information and a clear desire for voice, to participate in decisions and be partners in their care. They value continuity, and again, this is not being given in the ICU right now. Healthcare providers provided six major themes. They acknowledge sedation has become normalized and overused, driven by culture, not guidelines. They describe ethical tensions, protecting patients from suffering, families from distress, and themselves from emotional burden. They noted that delirium often goes unrecognized, risk communication is poor, and knowledge gaps exist between themselves and patients. It's hard to communicate with families, according to people we've interviewed. So here's a framework showing preliminary recommendations for participants. Families need education about sedation and consistent communication. Patients want information sharing and active participation in the recovery, not to be passive recipients. Both groups need continuity of care, support systems, calm environments, and involvement in decisions. These aren't final. We're still synthesizing how provider perspectives align or conflict with these needs. Here are references, acknowledgements, and thank you so much for listening.